In case you don't know me, my name is Dr. Joel Pasquale. I'm a physical therapist and I'm owner of Ant Physio. And I help people run even though they've been told they cannot run or should not run. But I want to show you someone that I saw recently at the grocery store, and watching her walk, it's like, it's interesting of how she walks and, even just interpreting where she might be having pain. But I want to show you how that person was walking, and maybe you could guess on maybe what she's feeling and what would we need to be done to fix and solve the root cause of why she's getting this pain. So let me go ahead and show you that. And if you guys are catching this live, go ahead and type live, say hello. And then if you guys catching us on the replay, type replay. But let me show you guys. So this is literally how she was walking. Let's see. She was walking fast, actually, at the grocery store. I'll do it one more time. Let's see. What do you think? What do you think that person might have been feeling on how she's walking? Go ahead and type your guesses on the chat. I'm just curious. What stands out to you walking like this? I know my guess, but I want to see what you guys think. And this is someone that's a little bit more, walking a lot worse than what is normally seen. But there is subtle cases where that subtle movement is actually less pronounced, but same kind of problem. So with that person actually has limited hip mobility. If you could see, because she's not stepping through her right leg as much because of the lack of hip mobility, she's compensating by rotating her back more. So you can even see how far her elbow goes when she's rotating, because this lower part of the leg doesn't want to extend with her hip. So if I show you, basically her leg doesn't want to go out this way, so instead she rotates into it. So she's getting a lot more rotation in the upper back. That's why you see her rotating. What do you think? What do you think is what's painful? Is it the hip? Is it the low back? A lot of times it's the low back. So you can imagine, even try that yourself. Take less of a step with the right leg and compensate by rotating a little bit more on that right side. You can feel a lot of that tightening on that right side of the lower back, those paraspinal muscles. So something that she may have done in the past is a massage, which you can imagine if the more she's walking, the more that muscle has to work. So by the end of the day, you can imagine that muscle is very tight and needs to be worked on and relaxed. And massage is good. It's going to help relax and decrease a lot of those symptoms. But what happens when she needs to walk again? Walk far. Maybe she works and it requires her to stand all day and then walk some more. Massage is going to help that time immediately, maybe that next day. But if she continues to walk, there's going to be an issue. And then figuring out why is that hip mobility not so good. Hey Shelly, thanks for jumping on. Hey Mavs. You could assume that it could be a muscle. So muscle's an issue. Also, is it the joint? Is the joint capsule not flexible enough where she could get enough gapping? So even this is the lower leg here. This is the pelvis, right? So technically we need to stretch the capsule right in here if there's not enough motion here, and not necessarily just the muscle. So you can imagine if the muscle is not flexible, also that joint is also going to be tight as well. So it could be a muscle issue, it could be a joint issue, also a nerve. So if it's coming from that femoral nerve up in the front of the hip, so we have joint and nerve. So it could even be the nerve from the hip or low back. I'll just put low back. So that's where we have to figure out what's the main issue. A lot of times it's all three. I would assume for sure these two, for sure at least muscle and joint, they come hand in hand. So it's not enough to just stretch, but we got to get in there and actually stretch that hip joint within that hip pelvis muscle. So then when we walk, we have to, I'm not the greatest drawer, but we got to get hip extension. We got to get that leg to go backwards. Man, I got to get really good at drawing. It's horrible. Sorry. But basically, we got to get that lower part of the leg to extend back. And if you're not getting that that extension at the leg, it's just going to compensate up the chain. It could be going up to your low back. Also, if it's none of these at the hip, it could even be at the ankle. We're not getting enough translation and ability to move forward on our lower part of our leg, and we're compensating by moving our foot out or even just extending up to compensate. It's all compensations. What's up, Jason? Thanks for coming on. But yeah, live. Thanks. How you doing, Jason? Are you off work? But yeah, this lady, you know, again, she's walking. This is how she's living every day, just rotating her back, walking like this. So I would solve the problem if I just work on that hip to get that more mobility and take away that pressure, that extra pressure that's going to her low back and getting her that low back tightness. So if you guys could relate to this, if you've seen someone like this, just type me, I'm just curious. Even so, this is an example of someone that sits at the grocery store walking, but this relates to people with running too. A lot of runners, I saw one last week. He says he's trying to get back into running, and just running that mile, he just feels his whole back just tightening up. And putting him on the treadmill and watching him run, yeah, you can see it. You can see those paraspinals just firing. And when he really pushes off, you can see rotation at that pelvis, just because it's just the path of least resistance, that less mobility at the hip, it's gonna go up to the back. So fixing it involves stretching, but also involves a whole program of strengthening, because it's not enough just to stretch. We need to do stretching, strength, and then movement corrections. So, seen it in others, Shelly? Yeah, so that's why we don't have to treat the area of pain. That's where definitely someone is feeling the pain, but to treat the solve the root cause of why the pain is, we have to look everywhere. I mean, you could see when people are running, when people are running, you could see how much rotation how far back their elbow is going. One might be not going far enough, and it's like, why is that? So we really got to look at someone holistically, watch them actually do the activities that they're complaining of, and figure it out. But my tripod's about to fall off. But just wanted to throw that out there. So if you've been suffering from pain and you've been doing massage and wondering why it's not working, this might be a reason why. So if you guys have any questions, just drop a comment below. I'll go ahead and comment later. Or if you have any other questions on any other conditions, I'm happy to go on live and just talk about it. So hopefully you guys have a great day. I'll talk to you guys later. Thanks, guys.